Okay, now we're going to be looking at muscles of the lower extremity. So we're going to talk about some muscles of the hip and some muscles of the thigh. So let's take a look at some of the basic orientation of what we can see from the anterior and the posterior and get used to some of the terms like quadriceps and hamstrings and adductors and abductors, hip flexors, hip extensors. So here from the anterior hip, we can see two muscles. One is the iliacus, one is psoas major. These two muscles combined, as they go under the inguinal ligament, they insert on the lesser trochanter of the femur, and they typically call those two muscles one, called the iliopsoas, because it's the combination of the iliacus and psoas major. Psoas major originates on the lumbar vertebrae and their discs, whereas the iliacus originates on the iliac fossa. Again, both insert on the lesser trochanter, combining the iliacus and psoas major, joining as one, calling the iliopsoas. That's your primary hip flexor. Now here's the iliac crest. There's your ASIS, the anterior superior iliac spine. We can see the inguinal ligament originating there. We see the longest muscle in the body called the sartorius originating there. We can see the TFL, the Starbucks muscle, tensor fasciolate, right? That also originates on the ASIS, sartorius and TFL. TFL, the tensor fasciolate, inserts on this iliotibial band. It's this tract that runs from the ilium all the way down to the tibia. So it's called the iliotibial tract, or ITB, iliotibial band. In the front of the thigh, besides the longest muscle in the body, the sartorius, we have four quadricep muscles. There is the vastus medialis, the vastus lateralis, the vastus intermedius, and the only way we can see the vastus intermedius is if we take this superficial muscle here, called the rectus femoris, and we cut it. So here to here, we cut the rectus femoris so we can see what lies deep to it, called the vastus intermedius. All four quadriceps cross over the patella and insert on the tibial tuberosity. The soft tissue structure above the patella is called the patellar tendon, also known as the quadriceps tendon. And that's how the quadriceps attach to the patella by way of the patellar tendon or quadriceps tendon, but it doesn't just end there. It crosses over the patella and inserts on the tibial tubercle or tibial tuberosity by way of the infrapatellar tendon, because it's below the patella. The other name for the infrapatellar tendon is the patellar ligament. So you should know the four quads. Those are the vastus sisters, the vastus medialis because it's medial, the vastus lateralis because it's lateral, the vastus intermedius because it is between both of them, and then the rectus femoris. The rectus femoris originates on the AIIS, the anterior inferior iliac spine, but it too inserts on the tibial tubercle. These will extend the leg. They're powerful leg or knee extensors. Like you wanted to kick a soccer ball, you have to extend the leg. The rectus femoris crosses the hip, so it can also flex the hip. So it flexes the hip and extends the knee, as if you were running and trying to jump over a hurdle with your leg stretched out like that. Your hip is flexed and your knee is extended. On the inside, these are all adductors, adductors. So we see you have an adductor magnus, an adductor longus. There's the pectineus, and under the adductor longus is a muscle called adductor brevis. So in the inner compartment, These are adductors. Sartorius is the longest muscle in the body. Second longest muscle is the gracilis. When we take this and we look at it from the posterior and we flip it around, we're cutting the large muscles of the hip called the gluteus muscles. So we cut the gluteus maximus, which is a powerful hip extensor. We cut the gluteus medius, which is a powerful hip abductor. And what we left is the one that's deep to it called the gluteus minimus. So there's a gluteus maximus, gluteus medius, and a gluteus minimus. Gluteus maximus is a hip extensor. Gluteus medius and minimus are both hip abductors. With those cut, we could see the sciatic nerve, and we could see the 6 deep lateral rotators. You can see 5 of them, really. The 6th is on front. We could see the piriformis above the sciatic nerve. Then we can see the gemellus superior. We have a gemellus inferior. We have a quadratus femoris. So there's actually 6 muscles that are around the hip that are called 6 deep lateral rotators, also known as the external rotators. And they're called please go, go quietly. P-G-O-G-O-Q. Please go, go quietly. The P is for piriformis. The G is for gemellus superior, and then gemellus inferior. Those are the G's. The O's are for obturator internus and obturator externus. And then the Q is for quadratus femoris. Those are 6 deep lateral rotators. They all attach to the greater trochanter, and they laterally or externally rotate your femur, okay, or your thigh. When you externally rotate your thigh, your toes point outward. On the posterior side of the thigh, we have hamstring muscles. And the hamstrings originate on the Ischial Tuberosity. There are 3 hamstrings. 1 of them is lateral. 2 of them are medial. The 2 that are medial are the semisisters, the semitendinosus, and the semimembranosus. So those are the 3 hamstrings: bicep femoris, semitendinosus, semimembranosus. They cross the hip so they can extend the hip. They cross the knee joint so they can flex the knee. Completely antagonistic to the quads. The quads can extend the knee. The hamstrings flex the knee. The hamstrings extend the hip, whereas the rectus femoris flex the hip. So they're completely antagonistic. So here is the pelvic brim. Right, here's the iliac crest, iliac crest. Here's L5, L4, L3. So this muscle here is the psoas major. And what does psoas major do? It is the primary hip flexor, which is your thigh flexor. Here is the longest muscle in the body, called the sartorius. It's a superficial muscle. It originates on the ASIS, comes down, and inserts just medial to the tibial tubercle on the medial side of the tibia. So that's the sartorius. What is the insertion? Well, if we follow it down, it's going to be just medial to the tibial tubercle. So that's the proximal medial shaft of the tibia. Best answer. It's the only thing it can be based on all those choices. Now here's the posterior. Here's the gluteus maximus. We're looking at this structure that's going from the ilium all the way down to the tibia. That's the iliotibial tract or iliotibial band. The gluteus maximus inserts on the ITB. So does the TFL, the tensa fascial lata. Remember, the TFL, we pointed here. So here's the tensa fascial lata. It inserts on the iliotibial band, and on the posterior side, here's the gluteus maximus inserting on the iliotibial tract. Okay, what's the structure that's highlighted? We said this is the sartorius. Now we're looking at the gluteus maximus. It's the posterior portion, and the gluteus maximus is going to insert on the gluteal tuberosity of the femur. There is a gluteal tuberosity of the femur. Nothing else makes sense here. Iliac crest, that's up here. Ischial tuberosity, that's here. Pubic, that's here. Iliac fossa, doesn't make sense, right? So gluteal tuberosity of the femur. Identify the origin. So the origin is going to be the ala of the ilium, the sacrum, and the coccyx. Best answer for the gluteus maximus. Nothing else there.